Welcome to the Health Insurance Marketplace. Para continuar en español, marque el 2 ahora. Let's get started. What state do you live in? I need to know where you are looking for
Ohio.
coverage. Find the insurance options that are... What was that? Please tell me the state you're calling about.
Ohio.
Ohio offers health coverage through the Health Insurance Marketplace. Would you like to hear more about the marketplace? You can say more information or say representative.
Representative.
Marketplace representative. All right. Our marketplace representative will be happy to help you. I'll connect you now. This call may be monitored or recorded for quality and training purposes. After speaking with the marketplace representative, would you be willing to take part in a short survey about your customer service experience?
No.
Thanks for calling the Health Insurance Marketplace. John Taylor, how may I help you?
Hi. I just learned about this new healthcare thing, Obamacare. And
The American Care Act?
huh?
Yes, sir. The American Care Act.
Is okay. Are those two separate things?
No, the American Care Act is the actual name of it. You refer to it as, what was that you said?
Obamacare?
Yes, sir.
Okay.
But the actual name is the American Care Act, the ACA.
Okay. So I just learned about this, and
Okay.
it's a new law. Do I have to do this? What is it?
Yes, sir. I'm sorry, it's called the Affordable Care Act. Excuse me. The information. Well, I mean, in general, the Affordable Care Act increases your access to health insurance by creating a health insurance marketplace where you can shop for private health insurance plans. Health insurance plans available through the marketplace include extra consumer protections that are in your best interest. When you buy insurance at the marketplace, health insurance companies can no longer deny your application or increase your premiums because of your age or health status.
Okay.
These protections apply regardless of whether you buy through the marketplace or not.
I've never had health care or health insurance. I've never really needed it.
Okay. Well, I mean, it is a law that every American, has, well, not only just Americans, but, U.S. citizens and U.S. nationals have to have. And if not, there is a fine or a fee that you must pay, if you don't. And it increases, as the years pass. And I can give you an example of the fee for not having coverage. The Affordable Care Act requires most people to maintain health insurance. You get insurance through your job or through the health insurance marketplace or directly from an insurance company. After the open enrollment ends March 31st, 2014, you cannot get coverage until the next annual enrollment period unless you have a qualifying life event such as birth or marriage. If you do not get health insurance in 2014, you may have to pay a fee. The fee in 2014 is 1% of your yearly income or $95 per person for the year, whichever is higher. The fee for uninsured children is $47.50 per child. The most the family would have to pay is $285. Amounts go up after 2014. 2015, the fee rises to $325 per person or $975 per family or 2% of income. And, of course, that is whichever is the higher. For 2016, it raises even more. The fee per person will increase to $695 per person or $2,085 per person, or 2.5% of your household income, whichever is higher. For children, it will be half that amount, and there will be an overall cap for family payments. From 2017 on, the fee will rise each year with inflation. So you will also have to pay the entire cost of all your medical care if you do not get health insurance. An insured person will pay the fee for 2014 and 2015 when he or she files a federal income tax return. If you don't pay the fee, the Internal Revenue Service will hold back the amount from any future tax refunds. There are no liens, levies, or criminal penalties for failing to pay the fee.
Okay.
So it's pretty serious. Now, I mean, you could very well
This is pretty serious.
volunteer an exemption.
Okay. Okay. So this is you said it's a law. Is there any other repercussions for not doing this? I mean, are they going to arrest me? I've never.
The only way that you would possibly be facing arrest if you intentionally, if you intentionally commit fraud towards, federal government or, IRS or in your application. But other than that,
No.
I do not believe there is jail time, for not, for not participating.
Yeah, no, I wouldn't do no fraud. I'm a law-abiding citizen, and I do everything I'm supposed to do. I wake up and go to work and just live my life. I heard that. How much is the is this coverage? How much is it going to cost me?
Well, the coverages, there's several different plans and coverages. It all depends on your state, what state you reside in, and the requirement. Because there are student health plans.
Okay.
And, the American government, they have determined that there has to be what is considered essential health benefits. And this is to cover, America's, citizens and nationals.
Okay.
Because they want to make sure that there are birth control benefits, preventive and wellness services, preventive services for children, women preventive services, and, different things of that nature.
So how much?
So, I mean, if I...
How much is it going to cost? How much is it going to cost me?
What we have to do is get you enrolled, or I can give you the... I can get you enrolled, or I will give you the website to where you can go on and you can create an account and fill out an application at your leisure.
I'm sorry. I don't have a computer.
Okay. Well then, I mean, if you want, sir, you can stay on the line with me, and we can fill out an application, and we can get you enrolled.
Okay. Can you give me an idea of how much it's going to cost?
Well, there's different variables, and I can't, pinpoint on how much it's going to cost you because it would depend on if you possibly have any dependents, if you have any, student loan interest that you are paying, or any out of cost tuition that will come from line 34 on your 2000.
I don't have anything. I don't have anything special. I don't have kids. I don't have a wife. I'm not married. I'm not a homeowner. I have a job and I have my body. That's it.
Okay.
There's nothing special.
Well, I've seen prices as low as $0, which would allow a person to fall back onto their state Medicaid, and plan starting at let's say $100 $750 a month to up to $700 a month, but that was for what is considered a platinum plan, which gives you 90%, which covers 90% of your cost.
Okay. I make I make $11 an hour.
Okay. Well, I mean, it sounds like you want to go ahead and at least put an application in to see what you qualify for. Is that something that we want to go forward with?
I guess. I mean, I used to work 40 hours a week, but they just recently took me down to part-time. And I asked them, and they said that my employer told me that it was actually because of a new health care law, and I didn't really believe it until until I heard about this, and I called you, and I guess this is why they decreased my hours. They took me down to part-time.
Well, so one of the acts is stating that they have to offer you part of the Affordable Care Act. Let me see if I can pull up that information for you. Give me just one moment, please.
I mean, when I was full-time, I probably could have afforded $100 a month or whatever it was. I heard somewhere else that it could be like $60 a month, but I can't even afford.
Yeah, it could. It definitely could.
I can't afford one more bill. It's all I can do to pay the bills that I have. If you said that there's a fine, you said there's a fine for the first offense. Is there like a limit to the number of offenses that I can have if I don't sign up for this?
No, sir, but it will increase. As I spoke, it will increase the higher. As the years roll through, it's going to just continue to increase. Because they want to make sure the Affordable Care Act, it is designed to make sure that you are covered in case anything, happens to you, and that you're not just left out to pay expensive medical bills that could, really eat you out of house and home.
Yeah. Well, I can't.
You said you never needed it. You said you never needed anything before, but
no.
It's hard to foresee the future.
Well, I'm 25 years old. I'm healthy. I don't smoke. I don't drink. I'm healthy. I don't need health care, and I don't need health insurance. I don't really do much that puts me in danger. I can't really afford. Is there a way that you can waive this for me? I can't afford the fine, and I can't really afford another payment, especially for something I don't need.
I understand what you. Right, I understand what you mean, but if like I was reading in the exemptions, if you only make a certain amount, like if you may qualify for an exemption to where you can still have health coverage, and you have to pay nothing.
Oh, okay.
The only way for us to be able to determine that is to fill out an application and submit it and get the results back.
Okay. Well.
And I can do that for you while you're on the current call. That way, because I don't know how long you were on hold or waiting to speak with a representative.
Mm-hmm. How long does it take?
You'd have to. I've seen it take as little as 20 minutes, and I've seen it take as much as an hour and 30 minutes.
Wow.
But I mean, that depends on the information. And you said you just have yourself and your job, so that shouldn't take us long at all.
Yeah. Okay. What kind of information do you need? Personal information, like.
Okay.
I don't have to give Social Security numbers in it.
No, sir.
Okay.
No, it does not. Right now, I need your last name.